Healthcare involves a lot of complexities, and sometimes it can be a challenge to make sure all of the pieces are working together effectively. That's why we're here talking with community health centers to find out what they do to be successful. With me today is Margaret Brennan, CEO of Community Health Centers here in Central Florida. Margaret, thank you for being here today.
Thank you for having me.
Of course, absolutely. Margaret, tell me a little bit about Community Health Centers.
All right. Well, Community Health Centers is an organization that's a not-for-profit agency. It provides health services for patients from birth to older senior citizens. So we provide services to children, families, adults. We have pediatric services, family services, optometry, behavioral health, pharmaceuticals, radiology. It's really comprehensive full services. We serve about 60,000 patients here annually, and we have about 140,000 visits. So it's a very large organization with 13 locations in Orange and Lake counties.
That's a lot of different parts all working at once, all working together. And of course, there's a lot of challenges with that. So what is the strategy? Like, if you had to get to the heart of that, how do you make all of those things work together?
Well, certainly an electronic healthcare system really is very helpful to us to make sure that all these parts and pieces come together. So when you're looking at an organization as large as we are, we need to make sure that we understand from the patient's first entry point into the health center delivery system. So from scheduling the appointment, accessing the financial information on the patient, all the way through the office visit itself, education to the patients, follow-up appointments. It really needs to be very comprehensive. So we need to make sure that we can collect all that information in one happy place so that the doctors, the receptionists, really everyone that has access to that record has the opportunity to review that. It's also important for patients to be able to access information for their own needs. Patients often travel around from system to system. They may access the pharmacy, they may access the hospital system, then go back to their doctor's office. So I think for us it's very helpful to have a comprehensive electronic health system that mirrors the system that we have in our complicated healthcare delivery system at community health centers.
And mentioning that challenge, that brings to mind the question of, well, what do you do when the patient is traveling around? You know, there's that information that you've already recorded once in one place and hopefully very completely. And then there's a chance that at the next place they might not be as thorough because they're focusing on whatever the problem is at hand there. I know that, of course, the eClinicalWorks has things that can help with that. Enterprise directory, sharing information through P2P with the CCDA, and now the Hilo Hub, of course, as well. Have any of those been put into place, or are there any thoughts about putting those into place?
We actually use most of the services that you're describing already in some degree or fashion or another. We really find it very helpful. If a patient enters into a system, perhaps one day they go to the hospital system and then a few days later they come into a physician's practice. So to be able to access the information and the records that have come across from the hospital into the primary care office is very important for the physician to see. If the physician then orders things or refers to a specialist for that information again to travel through to the specialty office so that the specialist that they're referring to also sees the patient's information. Perhaps the doctor's on call and covering it's after hours, the ability to be able to ring up that record to see that, oh, Miss Jones was in the hospital recently, she's had prescriptions that were ordered for us at our pharmacy, the doctor has ordered her to now go to a nephrologist. So all of that in one comprehensive location is very important. It's also important for the patient to be able to access that information. You may go to a specialist and they may ask a question and you can easily bring up your information just accessing the portal to be able to see the same thing, what current medications you're on and things like that. So having a record that's so comprehensive, the ability to have that at your fingertips is very helpful for within your organization as well as when you're walking outside and going to another location.
Join us in Nashville, Tennessee for the 2015 eClinicalWorks National Conference, October 16th through the 19th at the Gaylord Opryland Resort. Join over 4,000 eClinicalWorks clients just like yourself as we take the national conference to new heights. Our event schedule in Music City is jam-packed from start to finish, kicking off with a keynote and product showcase by CEO Girish Navani at none other than the Grand Ole Opry.
Follow that with over 120 breakout sessions, on-site support and training centers, and an exhibit hall with the latest and greatest in eCW innovations. We can't wait to see you at this year's conference, where we'll be kicking up our heels in Nashville, Tennessee.
Now, you're newer here, right?
Yes.
Tell me what kind of a perspective has that given you on what's going on here?
Well, I've been in healthcare for many years, over 25 years, and I started in a time when electronic health records were just starting, and there were a lot of programs that were being built kind of on-site, and they were being customized for their particular organization. That was well and good, but they really did not interface with other organizations. They were not really controlled. I went from that organization that I started with initially to another system that is a peer system of yours. However, that one is not as comprehensive. It's not protected. So it's really, having gone from one program to another. I think what I really like about eCW is that it's flexible in that you can make some changes, but it still has standardization. If you put information in and it's not categorized properly or things are not talking to each other, you can have a system, which I've had in previous organizations, where it's sort of garbage in, garbage out. So you don't have the support and the follow-up from some of the other partners that you do with eCW. So you have a strong team, of support team that's listening to the consumer, to the vendor, to try to make sure that the program really meets the needs of the organization. So you're able to do some customization, but yet maintain the integrity of the program. So having come from those various programs, I see differences in the quality that's coming out of eCW.
You bring up a very good point about the data that goes into the system. And of course, the big benefit of an electronic health record is that you're able to get the data back out of the system much more easily than you could on a stack full of papers. But that leads to the question of whether that data is useful to the organization, right? It can be recorded, it can be easily called up, but how do we make sure that we're using that data to our best effect?
Well, that's true. Sometimes you're overrun with data and you're not sure what to do with it. You have all this information that comes out. So I think knowing, and again, working closely with eCW and the vendors and people to help you to make those reports user-friendly, ensuring that the information that you're querying is concise and is what you really need. But also, what do you do with it? So you can find out that you have a patient that has abnormal A1Cs. They're not getting the care that they need regularly, or they're not coming up for their appointments, they're not showing up. What do we do with that? How do we take that next step further to ensure that the information that we're receiving helps us to enhance or improve the patient's outcomes? So it's taking the data and making it work for us and making it work for the patient. It's all about making sure that the patient has health improvement, better outcomes, that they're following up with their appointments. So the information that comes out of the computer system has to be something that we can do something with.
In a previous episode of the eClinicalWorks podcast, we discussed the importance of the clinical information that's stored in the system, and talked about how eClinicalWorks tools like EBO can help practices create some custom clinical reports and things like that. Go ahead.
Yes, that's exactly what we would need to be able to query, to pull up the list of patients that are outliers that you want to follow up with. Same thing with patients that are not keeping appointments, to be able to query and get that information and then to target those patients. If you're reaching out to the patient, you need to know who those are. So I think it's important to be able to get that information, sometimes just as simple as possible, but lists that can help you. If you have patients that are having cardiology issues, perhaps they came out of the hospital, they've had a CABG surgical procedure, and you really want to target those patients, or again, those patients that are brittle diabetics. So how best can you get the information on them in a user-friendly manner that you can then query those patients and make follow-ups?
If any of our viewers have the same questions about getting that clinical data out of our system, you can check out our previous podcast on HBI services and creating reports in EBO. And of course, you can also get some more information about our HBI services in general. So you are a HIMSS Davies Award winner as well.
Yes, 2014. Very excited about that. Yes. We really could not have done that without working closely together with eCW and the team that you have. It's so important to us to be able to shout that loud and clear. The fact that the projects that we have to share about that, our award, are related to return on investment. And so, of course, that's always very important to make sure that you're getting a return on investment for the input that you have in there. So it's definitely helped us with patient service and patient care and following up. And it's been a wonderful, wonderful partnership together with winning that award.
Well, Margaret, thank you so much for taking the time to speak with us today. We're going to be speaking with some more team members from community health centers to learn some specific workflows and specific improvements that you can make in your own practice to try to have the same return on investment that they've enjoyed here at community health centers. Thank you, Margaret.
Well, thank you very much for having me here.
Of course, anytime.
This broadcast and its contents are the sole property of eClinicalWorks and are protected by federal law and international treaties. You are strictly prohibited from making a copy of, modification of, or form of rebroadcasting or re-encoding this broadcast without prior written permission from eClinicalWorks Public Relations, except as may be permitted by law. This broadcast is provided for informational purposes only. It is intended as a personal, non-commercial use. Product specifications are subject to change without notice. Please contact eClinicalWorks Public Relations with any questions. eClinicalWorks V10 EHR is ONC HIT 2014 edition certified as a complete EHR. eClinicalWorks V10 CC 2014 955447-1.